So where did you get up to last time?
Um, I passed this thing because I didn't submit on time, so I passed it. I'm on the second one now. I mean, second to the
Amazing.
last one. Yeah.
Amazing. So what should we do today? We're going to um what should we do today? Learning outcome, which one?
Um. So yeah, that's we
Um,
we're going to.
mhm.
When is that one now? Mm, well, I will start that one just Sunday. Because I have two more courses to go.
I know. I know.
I want to see you.
We have LO1, we have two, we have three. So which one do you want us to?
The second to the last one, I want to see what the topic is. Don't remember very well. Mm, sorry. Good, good.
We have from 1 to 4.
Yeah, the one we're planning to do today is the management in health and social care.
Okay. 1 minute. One minute.
Yes, sir.
It's resource management, isn't it?
Huh? What
It's
did you say?
resource management health. That's a unit, isn't it? Resource
Yes.
management. 1 minute. And what do you say today's topic? Principle of leadership management, isn't it?
Um,
Am
no,
I
not
right?
possible. No. Um, that's management in health and social care.
That's learning outcome two, right? 1 minute.
Yeah.
Management in health and social care. 1 minute, please. So 1 minute, please.
Yes, sir.
So we have a session. Okay. So just 1 minute. That resource management have, so we have just 1 minute. Do you say management, health and social care, right?
Yes. Health and social care management.
Okay. And we did one the last time. Which one? We did the first one, right?
No. The one we did was health and safety in health and social care settings.
Okay. So is
So
that
the next one is the health and social management in health and social care.
okay. Okay. Okay, that's fine. So let's work on this and then. Good. So is it automatic or manual you're doing?
Automatical.
Okay.
It's automatic. Can't do that one. I'll just waste my money.
Mm,
It's too hard.
I know, it's no joke. So what we have here is, let me see what you have. What was the task?
Um,
What was the question? What was the task?
the first question says, I'm not with my laptop.
Okay.
The first question says, first question. So it said, having read the article, prepare a report in which you analyze the internal and external influence affecting human resources planning in health and social care. The second point says,
Didn't we do this the last time? We didn't, eh?
no.
Okay. Okay. All right.
This one looks so complex. Like, I've not even opened it. I've not started at all.
Okay, we'll help you. So the question is, we did risk assessment the last time, didn't we?
Yes.
So
That's under health and safety in health and social care.
okay.
So this one is management in health and social care.
Okay. Uh, look, let me check something. Or is it? I want to
The
have
one
this. I want to have this slice or something.
That one that we did was we talking about the risk assessment and all. Yeah, but this one is management. That one was health and safety in health and social care settings. But this one is management in health and social care.
Okay, bear with me.
They look familiar. They look similar, Jerry.
They look similar, isn't it?
Yeah.
I don't have this.
Management.
Resource. Okay, so okay. Well, what I'm seeing under resource management, and I have recruitment in health and social care.
No.
Okay. Which is it, LO1 or LO2 in your side? Is it task 2 or task 3?
It's not tax, it is another course.
Yes, but what's that? Is it not resource management in health and social care?
No.
That's strange. Because the Zoom lecture today is resource management, so I don't know why we're not having. Unit OTM level 6 unit resource management.
OTM level 6 in
Yes.
health and social care.
Resource management. That's what we're supposed to have today.
Oh.
Yes. So you might be in a different one then. That's what I was scheduled. The unit is resource management in health and social care tutorial.
Oh yeah, that's true. Yeah. Yeah. Yeah, that's true.
And I sent you the link.
Yeah, that's true. I just went through the yes. Which one was I now reading? That's another course I was reading.
Yeah, that's another course. Yes.
Because we did health and safety in health and social care settings.
Correct.
So, I didn't put the resource. I just put management in health and social care. It's still the same thing, but it is resource management in health and social care.
Yeah. Have you seen it now?
Yes.
Hmm. Hmm. Okay, so which of them are we supposed to do today?
It is resource management in health and social care.
Okay. Okay. So that'll be we're going to start afresh, or because this is a tutorial, so you need
Yeah.
to say which of them you want us to, you know what I mean?
Yeah, it's resource because that's the one I've not done. And I've not even started at all.
Okay, you've not started at all. Okay.
Yeah. So I don't really have idea because I've not
Okay.
started reading or do any research. But I know it's still gonna lead me to the ones I've been doing
Okay.
one way
That's
or the
fine.
other.
Okay. I'll share the screen. Check if it's okay for you.
Okay.
Can you see the screen?
No. Yeah, can see now.
Is that resource management?
Yes.
Okay, that's fine. So, so so in today's tutorial, this is not a lecture, it's tutorial, isn't it?
Yes.
Mhm. So resource management. But basically what we want is to bring to your understanding the factors involved in the human resource planning. You mentioned that, isn't it? You mentioned
Yes.
something about human, isn't it?
Yes.
So let's look into, I mean, when we talk about human resource planning, obviously we have to look at human capacity and all that. Yeah.
Mm-hmm.
Okay. So just 1 minute. Still recording. So 1 minute. Are we still recording? Okay. All right. So what has been your, I mean, your struggles? Um,
That's what I just said, that I've not started, so I've
okay.
not start struggling with anything yet.
Okay.
Just because last night, because I used to
Mhm.
do my assignment every Sunday and Tuesday. That's why it takes me 2 weeks to submit.
Okay.
So, but this week, since on Friday, I've been trying to go through the um I've been trying to go through the what's it called, the PDF.
Okay.
Yeah.
Okay. You're going to
The
PDF, eh?
specification and everything, just trying to know
Mhm.
what they will be expecting from me and what I will be
You want
what
to know
they,
what you be expected from you for this particular unit, right?
yes.
Okay, so let me quickly go through. Let's have some discussion on. Let me just um let's do a quick catch up, then we can go to the assignment discussion briefly.
All right.
Yeah, briefly. So I mean, as an HR, factors that are involved in human resource planning. I mean, obviously, what may be the factors that involves? I mean, obviously, there are staffing levels, workload, the skills and competencies that you need to identify. So when we say workloads, we're looking at determining the number of staff required for the safe, effective delivery, the balances of workload. So example, a care home calculates the number of nurses and care assistants needed per shift based on the resident dependency levels, of course. I mean, if the care home need agency staff, then obviously they have to look into the number of residents in the service unit. So to determine how many carers will be needed for a night shift or during the day or whatever pertaining to whatever clients available. Sometimes they may need less because if a client or service user may be able to do things on their own, then they may not need any staff at all. But they also have to look into the skills and competences. Okay, it's very important that the kind of staff you are bringing have certain skills. So, for instance, if the patient is somebody that needs a trachea or stoma, then you need to ask first of all, check if any of your staffs have some special training that would help the patient. Okay, or the person have some special training in physiotherapy or mobility rehabilitation skills. Then you look into a patient that may have, sorry, a service, a support worker who have certain additional skills that will help the patient as well. Okay. Now, I would quickly want to go into the brief, which we'll need to go into briefly. 1 minute. This surely will have to be 5, 2, 2, 3. Yes, so we have this. 1 minute. So just bear with me. Let me just check something for you so we could have. We have any question? So I hope you're here with me. I hope you're there.
Sir,
Can you hear me?
very well.
Okay, that's fine. Just hold on. I'll need to see if I can get you some job, some L04. Let's see what we have here. What was your question? What was your task from your side?
Okay.
Mhm.
The first task says having read the article, prepare a report in which you analyze the internal and external influence affecting human resources planning in health and social care. The second one says explain the determiner of skills required by health and social care organizations. Describe how to address any skills gaps which might exist in any organization. Explain the factors involved in planning of recruitment in health and social care. The next one says describe the relevant legislative and regulatory frame that affect the recruitment of selections in health and social care. The last one says evaluate the different techniques used in selections of process in health and social care.
Mhm.
So that's for tax one.
Mhm. Okay, so let's hold on. Let's take it one by one, please.
But there is an article I have to read and then I will then answer the questions
So
below.
where's the article?
There is a link I'll click on. I'll
Very
click
good.
on.
Okay, so let's look at the first question without the article. Let's look at it. Let's start again. What was the first question?
Analyze the internal and external influence
Mhm.
affecting human resources plan in resource planning in health and social care.
Okay, analyze the what? The
Internal and external influence.
internal and external influence. Okay, what was your take?
Human
Internal
resources
and external
planning.
influence here. So this is where we are. Can you see the screen? Can you see the screen?
Yeah.
Those are internal. So these are some of the things that, can you see it?
Yes.
So when we say internal influences, what are the things that we're expecting from what as HR in an organization, what may be the internal influence that may affect HR planning?
For internal,
Yes.
do you want me to read this out?
No. I'm having a discussion with you.
According to me, it's still one of it is the organizational structure, which is um how things is being put in place.
Mhm. So, I mean, when we talk about HR planning, it's all about human capacity, isn't it?
Yeah.
And so, when we say what may be the internal influences that may affect HR planning, we should look into the staff skills and competence, isn't it?
Yes.
And then also organizational structure. How the organization is structured different from one organization to another. And so the structure of the organization may either affect staffing needs, roles, or responsibilities, don't they? So, an HR has huge, complex job to do if a company have so many departments, isn't it?
Yes. Yes.
So, as I may say, an hospital with multiple departments, surgery, ICU, physiotherapy, needs specialized staff for each area. So, depending on the structure for the organization, will determine how the HR will function, isn't it?
Yes.
Because you may have um, an organization with different departments, and therefore you ought to have um, some kind of HR coordinator for each department, but you may have a general HR manager or a general HR director. I don't know if you're getting what I'm saying.
Yes.
Yeah, because how huge there must be an HR person for each department. However, they will have a specialized HR department also that oversees all or coordinates all the HR staff for various departments as well. So those can determine the structure of the organization, can whether it's a huge organization or a medium kind of scale organization. You understand? That will determine the structure, that the needs, the staffing needs, the roles, and the responsibilities. I don't know if you are getting an understanding of what I'm saying.
Yeah.
Are you sure?
Yes.
How do you understand that?
I understand, sir.
Really?
Mm.
Okay. So these are some of the influences, the nature of the organization can really affect, or the structure can really affect the needs, the roles and responsibilities of HR planning. It can,
Mm.
because if it's voluminous, HR planning would have to allocate different. So it's quite interesting if you have a huge organization or medium organization will determine the staffing needs, roles, and responsibilities. Then the staff skills and competence. The existing workforce skills determine recruitment and training needs. A care home that may need additional dementia trained staff if current staff lack expertise. These are all HR. So we can use SWOT analysis. You know about SWOT analysis? Do you know about
Mm.
SWOT analysis?
Mm.
You know,
No.
SWOT.
Yes. SWOT analysis.
Yes. So in SWOT analysis, what do? We check strength and weaknesses, isn't it?
Yeah.
Exactly. And so in HR, we have to look at the various.
Factors.
Exactly. Internally, what do they lose? What does the staff lack? Or is there a general staff problem? Is it that do they need general training or reorientation? Okay, do the staffs have up to date? Probably at a time where the HR the the old HR department, at the time that they were in existence at the time, they had outmoded, no IT system, they were doing things manually. You understand?
Mm.
But things have changed. AI has come in, so HR need to identify all these needs across the board, feedback, and then do new trainings or devise a new IT system where people will shift from manual way of doing things to a more digitized way of doing things, isn't it? So what HR planning does is that it always identify the core competencies and maximize it. What are the core competence of your staff or the staff staff general staff requirements or structure, and then you have to devise how the existing workforce skills determine the recruitment and training needs. The workforce will determine what kind of training is it. A workforce, who are these people? Are they more technical people? That will determine the kind of training you want to um upskill, or are they younger generation that needs a bit of IT training, or older persons that need a bit of technical training. So these things are training that needs are things that needs to be looked in, and then that can factor into your training needs as well. And then the staff turnover and retention. Obviously, high turnover increases recruitment and training costs, affecting HR planning, isn't it? Isn't it?
Yeah.
High turnover. Because so it's an example, if many nurses leave, the organization might plan for temporary staff or equipment. That will cost more money as well, isn't it?
Yeah.
Yeah, because if you are having your permanent staff, you save a bit more money than having to bring temporary staffs and paying agency large sum of money, especially the ones for short notice. You pay a little more money. What about organizational policies and procedure? Internal policies, such as flexible working, promotion opportunities. These things help in the HR plan, doesn't it?
Yeah.
But Mr. Like today, you are too quiet for me.
No, I'm with you, sir.
Or
It's because I've not gone through this, because
okay.
that's why
Okay.
I'm not flowing that much. I'm trying to pick points.
Correct. So procedures, internal policies. No, so flexible working pattern is very good. It tells people to join your organization, so when you have flexible working patterns, when you have promotion opportunities, it could be
Yeah.
maybe training. We just spoke about training opportunities, or even professional development. People do level 2, you help them to do level 3, level 4.
Mm.
Those things help retain staff.
Benefits.
Exactly. You best worker for this month, best worker for the year.
Not all organization does that.
Yeah, but these are the things that help. These are the internal that affect whether positively or negatively. Okay. A policy encouraging flexible shifts may improve staff retention and reduce recruitment pressures, of course. When you are
Mm.
flexible, people don't leave, so that there's no pressure on you to recruit new staff.
Mm.
Budget and resource availability. Financial resources internally affect the number of staff that can be employed and trained. Of course, you can't employ more staff when you don't have what it takes to pay them. So you don't want
Yeah.
to limit yourself. Okay, so you need to have a limited budget. Okay, so these are when you talk about the internal ones, these are the things you have to look at. The external ones, obviously, there's something called PESTEL. Um, PESTEL. Have you heard of it before?
Mm-mm.
So write it down. And let me PESTEL. PESTEL. It's called PESTEL analysis. P
Mm-hmm.
PESTLE. PESTEL analysis. So whilst we use SWOT analysis in determining the internal factors, you're looking at your strength and weaknesses within the organization in terms of HR planning, and then you devise a strategy as an HR person to strengthen the internal core. PESTEL can be used for external factors. So when you say PESTEL, it's one of the things that you need to learn. PESTL, you know. It's one of the framework that is used to check the external macro environmental factor that affect an organization. Okay.
Mm.
Yeah. So have you written that PEESTL? PESTEL. The acronym that stands for political, economic, social, technological, environmental, and legal factors. Okay. Okay.
What's the E? What's the E? Political, economic, social, technical.
I'm writing it down. One minute. PESTEL. Political.
Economic,
All right.
social, technology,
Political.
economic,
Economic, yes.
social,
Correct.
technology. I don't know the EL.
You don't know the EL.
Yeah,
Environmental and legal.
environmental and legal.
Yes.
Okay. Hmm.
Environmental
And legal.
and then legal, yes. You need to learn, you need to know this, right? Very important.
Mm.
Like PESTEL, that's PESTEL. We normally use that to check. Normally, when you have to re-examine or analyze um, external factors that affect organization, you use this analysis, okay?
Yeah.
It's called PESTEL. Whilst you use SWOT analysis for the internal one, use what do you call it? Yeah, okay. Where political looks into more of the government policies, okay?
Mm-hmm.
You may have maybe where the environment where you live, the government policy doesn't favor the organization. You understand me?
Mm-hmm.
Exactly. So those are what we call politics. It may be issue with tax. The tax brackets may not be very favorable for the organization. Too many tax. Okay. And when there's too
Mm.
much tax, it affects your profit and therefore would also affect your staffs, isn't it?
Yeah.
Good. You know, there may be no political risk. There may be issues with political risk. There may be so much like kidnapping going on in Nigeria. You know what I mean? So imagine you have a company in that area. It's not going to affect the organization.
Yeah. True.
Wouldn't it affect it?
It will.
Exactly. So because the way the company is situated, these external factors of kidnapping, Boko Haram, and all that, people will even scared to come to work, isn't it?
Yeah.
Exactly. And so when we say external factors, these are some of the things that you need to look into. But
Yeah.
on the specifically, we're looking at the healthcare sector. So obviously there are external the regulators and the legislation that affect the organization. One of them is a CQC, which regulates and inspects organizations that they are doing the right in terms of data safeguarding of
Mm.
carers and then making sure that they are complying, they are complying with governmental regulatory policies and also ensuring that they are doing the right thing as government requires. And then you are putting things in place in terms of your health and safety and policies and employment law policies that seeks to address the need of the service users and the carers themselves as well. And then you can also look at labor market. I've just spoken about labor market, which I threw more light in terms of politics. Okay.
Mhm.
Yes, the labor market, is it favorable where the business is operating? Is the
Yeah.
market favorable for the business? Is it
Mm.
situated in an environment where the tax brackets are not too huge? In that it affects everything that they do. Too much tax from
Yeah.
HMRC and all that. So those are things the economic factors have just mentioned as well. Okay.
Yeah.
Yeah. Yeah. So when you say economic factors, we should be looking at the budgets
Yeah.
of the government for
Funds.
every year.
Yeah.
Exactly. Every year, governments have some budget. It may be mid-year
Um.
budgets, it may be yearly budgets. But then, are the budgets transcending? Are they having evidential, you know, impact on companies within the legal framework, okay, of the um place that the company is situated? You understand me? So,
Yeah.
for example, in the UK, as you must be aware, there's quite a lot of changes coming up for businesses. There's a lot of changes coming within the housing sector. You know, tax brackets are being slashed down. Minimum salary workers, there should be increase of every year, isn't it? Right, the minimum wage should be increased every year, isn't it?
Yes. Yes.
Why? Why? Why?
Yeah. Because of the economic sectors, things
Amazing,
are
amazing,
getting. Yeah.
amazing, amazing. That's a good answer. Because cost of living is going high, isn't it?
Yeah.
Gas and electric has been increased, isn't it?
Yes.
Exactly. And
There's a
then
lot of increase in almost everything.
almost everything.
So people's
Amazing.
salary should also get increased.
Amazing. Amazing. And so in London, you have your landing wages, don't you?
Yes.
And then in Manchester, they also have the Northwest have their wages as well. Because cost of
Yes.
living is more expensive in London than the Northwest,
Yes.
isn't it?
Yes.
Amazing. And these are the things that when we talk about economic
They
factors,
consider.
exactly. These are things that we need to consider as a student. And I've also mentioned the demographic changes, which also has a play to do with the political, but the demographic is quite intriguing and interesting because um, you realize that there's a lot of Gen Z generation in this era, isn't it? The aging population are getting older as well, isn't it? And
Yes.
so in analyzing the factors, you need to look at the percentages the Gen Z generation are kind. That would help you in your planning and the external factors. So, for instance, if the kind of product you produce is targeted more toward the Gen Z generation, the younger generation, and where
Yeah.
you are located, you have more older people, you need to reconsider, isn't it?
Yes.
You understand what I'm saying?
Yeah.
Yes. And so more elderly residents in care homes increase demand for trained carers. Obviously, whether we like it or yes, we agree that most care homes are filled in with older people rather than younger people. Am I
Mm-hmm.
right?
Yeah.
Am I right? Yeah. So it appears that care homes do consist or a summation of older
Children.
people, exactly, rather than young people. You may have few young people with ailment, mental health issues, depression, dementia, autism, and some supported living facilities. But then when we talk about care homes, the aging population do find themselves in those sectors, and therefore it is a requirement in terms of your staff intake, isn't it?
Yeah.
Your staff intake. Are you recruiting the right staffs? Do they have the technical know-how, the insight, the depth knowledge, the requisite trainings? Okay, that sort of and put them in a pedestrian where they can take care of this older generation. Key things that we need to, and we cannot talk about factors without IT, isn't it? Okay, so if you wish to do things in a certain way, now there's at the advent of AI, isn't it?
Yeah.
There are new technologies that you need to train your staff. So those are external factors. Whether we like it or not, the world is changing and you have to change, isn't it?
Yeah.
You have to
There's a lot
adapt.
of equipment that helps work move faster.
Amazing, amazing, amazing. And so we need to adapt. We need to learn them because how could you teach the younger generation when you don't adapt yourself with AI and new IT systems to be able to train them? If you're a lecturer, we learn new things and all new skills and for the certain roles that you find ourselves and all that. And then cultural and social factors. Okay, so remember, Pestle talks about social as well. Okay,
Mm.
expectations of service users and societal trends that may influence staffing strategies. Of course, if you have um if huge chunk of your staff are Muslims,
Mm.
some of them have to pray certain times during the day, isn't it?
Yeah, to
Amazing.
go to mosque.
To
Oh.
the most the cultural beliefs exactly so um these are factors that need to be so and not only Muslims, some kind of cultural barriers that you might need to go to, social barriers. They're quite committed to certain religions and every now and then they ought to comply. So these are things, and it may also be even issues of language. It could be a language barrier as well, isn't it?
Yeah.
You may have language barrier where oftentimes some staff don't really understand, some of the um, communication skills that have been transcend or transferred to them. So it's the
Mm-hmm.
expectation of service users and societal trends may influence staffing strategies. Of course, you may have service users who cannot speak English at all, isn't it?
Mm-hmm.
They cannot, or they don't really understand you. So how do you communicate? Okay, how do you communicate with them? So, an example, growing demand for culturally sensitive care may require staff with specific language skills. So, it is important that if you have service users who are Indians and cannot speak English, you try to employ, isn't it? Some Indians who can speak Urdu
Yeah.
or,
And
or
Gujarati.
Bengali, exactly. You know what I mean? Urdu, Bengali, and some other Arabic, languages. And that is why the NHS have
Mm.
all kinds of interpreters, isn't it?
Mm-hmm.
The NHS have interpreters who can speak Tree, some can speak Ga, and all kinds of interpreters just to ensure that the external factors will not have their way or affect the organization in that the organization cannot stand the test of time and therefore the organization are not able to meet up the demands of the service users and patients. Are we on
Mm.
track?
Yeah.
Sure?
Yes, we are.
100%.
I am.
Amazing. 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 And so the two questions has been looked into.
Mm.
So internal factors and external factor. What else was the question? What else?
Um, the other one say explain the determinant of skills required by health and social care organization. Explain the determinants of skills required by health and social care organization.
The determinants, right?
Yeah.
So that's what
Yeah.
that's what you're expecting. So this the determinants of skills required by the health and social care organizations, isn't it?
Mm-hmm.
And so top, and I mean, what do you envisage? I mean, what are some of the determinants of skills required by health and social care organization? Obviously, they need to have the skills to take care of their service users, isn't it?
Yeah.
So a service user, yes, the service user needs, okay? You need to have a
Yeah.
skill, care home, care plan, isn't it?
Mm-hmm.
You cannot be determinant. So there should be key determinants in the, but you see, the skills required in health and social care organization depend on the several determinants that shape what skills are needed. These determinants influence the workforce planning process, ensure that staff have the right expertise to meet service user needs, comply with standards, and deliver safe and high quality care.
Yeah.
Okay. So one, a service user needs. The type and complexity of care required determines the staff skills, isn't it?
Mm-hmm.
Or are you right on that?
Yeah.
Are you going to argue on that?
Can you say that again?
The type of complexity of care needs of the service user will determine the staff skills, isn't it?
Yeah.
So, what training will you give to your staffs? It's oftentimes is what you have gathered from your services, from what if they are dementia patients, majority of them, then you need to train your staff or employ staff who have
It depend
dementia,
on the
isn't it?
needs. It depend on the
Exactly.
needs or the kind of work
Exactly.
available that will determine the kind of training.
Correct. So a care home with most of its residents being dementia, obviously, if you are
Yeah.
recruiting, you want to recruit people who have dementia skills, isn't it?
Mm-hmm. People
Amazing.
that have good understanding about what
Exactly.
dementia is.
Exactly. That's what I mean. So those are needs. Okay.
Mm-hmm.
Then a type of organization and service provided. The nature of organization influence the skill mix required. Example, an hospital that requires specialized skills in surgery, intensive care, and diagnostics. A community care service requires skills in home-based support and social work.
Mm-hmm.
Okay. Legislation and regulatory standards. Legal and regulatory frameworks, CQC, etc., determine minimum staff skills and qualification. Example, only registered nurses with the right qualification can administer medication. Yes or no?
Mm-hmm. Yes.
Good. Good. So these are the determinants, isn't it?
Yeah.
Uh-huh. A senior carer can also administer, isn't it?
Yeah.
On what occasion? On what condition?
Um, you mean carers?
Senior carers.
Not only senior carers, a trained carer too can also administer medication.
A trained carer.
Yeah.
Okay. Okay.
Someone who has been trained to, because you have to be in care before you can be a senior.
Okay.
You can't become a senior in a day. So all those things are part. It has to be, you have to be in care for a time for a period of time before you can become a senior, isn't it? So it's not only senior carer that can administer medication. A trained carer can also administer I can administer medication and I'm not a senior yet.
Okay.
It's just
That's
that we
good to
have
know.
limits. We have limitation of administering medication.
Okay. Okay. That's fine. Okay. Well done. And so I'm sure you're getting understanding now. Okay.
Yeah, I'm with you.
Yes. Then technological developments.
Yeah.
Advancement in health and social technology creates new skill requirements. A staff must be trained to use electronic patient records. Are you trained on that?
A staff must be trained to use electronic
Yes. You know,
patient records. Yes.
yes, yeah, these
Yes.
days, or you in the past we used to do a lot of writings,
Mm.
but these days everything is IT, iPad, put things in
Yeah.
and all that. So these are all determinants. So but it depends the kind of service users you have. You understand?
Yeah.
It depends what is required exactly. So these are all determinants. Yeah, policies and care models, organization or national policies, AG, person-centered care, integrated care models, shape for workforce skill needs. Policies emphasizing holistic care require staff to develop communication, teamwork, and problem-solving skills. Okay,
Mm.
and we spoke about the demograph.
Yes.
Where challenging demographic influence, what skills are needed. Example, an aging population. We spoke about this already, haven't we?
Mm-hmm.
Then professional development and continuous training, CPD, skills required to evolve over time. So ongoing learning, CPD and all that. Example, nurses undertake CPD to stay updated. So with support workers as well, isn't it?
Yeah.
Good. So determinants of skills required by health are going to include service user needs.
Yeah.
Okay. Then type of organization and services. Whether
Mm-hmm.
it's a hospital or hospice or respite, you
Uh-huh.
understand,
Yeah.
will determine. You understand me?
Yeah.
Is that if it's computer based, community based, it will determine. So the type of organization and services will determine
Yeah.
what
Their
skill
needs.
set, what skill set that you may need.
Uh,
If most of the residents require that you take them out certain time, then you need carers who can drive, isn't it?
yeah.
Amazing. And if it's domiciliary care, it's the same, isn't it?
Mm-hmm.
Amazing, amazing. Legislation and regulatory standards. Legal requirements dictate minimum qualifications and skills, of course.
Yeah.
But the national requirements, CQC, or you name them, those are external
Mm-hmm.
factors that affect organization. It tells you that CQC tells you that by law, you ought to have safety for the organization and
Mm-hmm.
the staffs as well and the service users, isn't it?
Yeah.
And so, what are some of the CQC regulation, health and safety policy, fire safety policies, because you know what I mean? All
Yeah.
these things need to be in place. And you as the employee need to comply as well. It also tells you the qualifications that people need to continue CPD and level. At least somebody coming to care, recruiting a new staff should of at least what do the person need to have? Care certificate, isn't it?
Yeah.
And then you can progress on to level 2 or level 3, isn't it?
Yes. Sir.
Exactly. So from care certificates, what else do you do? Mandatory training.
Mm-hmm.
Exactly. And then you can enhance yourself level 2. These are minimum educational standards that or skills that qualification skills that you need to be. These are external factors that affect it, not because you want to do things anyway, but the organization that you know
Put you in
um
lead.
exactly. Nice one. The workforce and roles and specialization. Different professions need distinct skills. I didn't mention that in as much as you have the basic training for everyone, you may have certain clients or service users that may require very specialized skills from carers. One of it may be trachea. Have you heard of trachea before?
Tracker.
Trachea.
Yes. Yes.
Yes.
Tracker. Yeah.
Good. Have you heard of stoma?
Stomach bag.
Good. Stomach bag. So these are non-normal skills, isn't it? You
Yes. Sir.
ought to have certain distinct, isn't it?
Yes.
You
Sir.
ought to have to be
Yeah.
trained to be able to do that. Yes or no?
Yes. Sir.
Exactly. So it depends on the workforce and the specialization within the care home, or you may need certain staff with certain skills in those areas. Yes. All right. The
Yeah.
policies and care models, the influences on holistic persistent. It depends on the policies and the model. If the model dictates that or depicts that you have to have a more person-centered care or 24, you know about 24 hours care, right?
Mm.
Do you know about that?
About what?
24 hours care.
Unit 4 hours care.
24 hours care. 24
Yeah.
hours
Yeah. Yeah.
care.
24 hours care. That's living.
Not only living. You can have a supported living, which is 24 hours as well.
Mhm.
Living is not only, you can live in even you have to sleep. Somebody have to change you, but it's 24 hours. Once you go to sleep, somebody comes take over. It's 24 hours. You understand?
Yeah.
It's 24
Oh,
hours, not
that's
because
that's
you are
that the living is for individual, but the
yes,
24-hour care is it runs yeah,
yes, 24 hours. So somebody comes
mostly in
morning,
care home.
not only care homes, as supported living facilities as well. Okay, not
Okay.
only care homes. So somebody comes morning, he close before 1 o'clock, another person change over, isn't it? It's
Yeah.
24 hours. Why? Because the risk assessment tells you that the patient needs that, isn't it?
Yes.
It's not a patient you can leave here or here alone, isn't it?
Yes.
Maybe as a result of self-harm or
Mm.
once it's left, it was suicidal comments and all that. And so these are all things that helps as determinants. Okay,
Yeah.
good. Are we okay?
Mm-hmm.
Should we end or are we okay?
I'm okay. At least you brought so much light to the cause, and it's becoming interesting. I was kind of scared before, but now it's, and I would love to. I'll try to read more about it so I can, because it's becoming interesting.
Amazing,
Yeah,
amazing,
I'm
amazing.
very
So I'm
sure I won't
sure,
struggle much.
yes, I'm sure at least for now we are very okay.
Can you please just give me a brush up on this tax two and all,
That's to
because I'm
which
fine with
one?
tax one. The one that said instructions. You are required to prepare a business report for health and social care management, health and social
Um,
care
was it on
managers.
this topic or a different topic?
Still on this topic, sir.
Oh, really?
Yes, that's for tax two business reports. You know, the first one was just a report
Yes.
on an article.
Uh-huh.
So this one is a business report.
Is it? Okay,
Yeah,
let me see. Okay.
it has tax one and two.
Okay, read the second one. Read it again. Yeah.
The instructions on business report says you are required to prepare a business report for health and social care manager to ensure they understand the value of financial awareness and the different source of financial of finance that are available in managing health and social care organization. Okay, for the research, you should review it. Okay, for the research, you should review the published account of Bupa Limited, which
Pooper. Okay. Second
Bupa,
one.
yeah, Bupa Limited, um, which can be downloaded from, okay, financial result. Okay,
Uh-huh.
oh, this looks like a commerce.
This is
No, no, no.
exactly
This is
right.
like a commerce. It's like an accounting for
This is different.
a
Exactly.
report on an account. Oh,
Exactly.
this will take me back to secondary school
Ah,
because I'm an account student. So you have to your report should include this following: um an evaluation of financial statements of Bupa Limited. You should evaluate the structure, format and requirements format and requirements of the published account. Let me read that again. An evaluation of the financial statements. Your report should include the following. One, an evaluation of financial statements of Bupa Limited.
mm-hmm,
You should evaluate the structure, format, and requirements of their published accounts.
mm-hmm.
The second one says analyze the roles of financial information in decision making. Okay.
You
Oh,
get an understanding now.
yeah. The other one says an explanation show the key difference between long and the short term best financial needs of health and social care organization. An
Mm-hmm,
explanation of source an explanation of sources of financial available in health and social care organizations such as Bupa Limited. An
mm-hmm,
evaluation in implications of such implication of using such an evaluation of the implication of using each of the source of financial identity.
mm-hmm,
Um, no, let me read that again. An evaluation of the implication of using each of the source of
mm-hmm.
financial identified. Using Bupa Limited budgetary information. Using Bupa Limited budgetary information, interpret their budget in relation to service provision. Evaluate capital expenditure and investments project using different investments appraisal techniques. Evaluate the capital expenditure and invest project using different investments appraisal techniques. Make record make recognition make record recommendation make
Mm-hmm.
recommendations for financial management for Bupa PLC. Make recommendations for financial management for Bupa PLC. Make recommendation for financial management for Bupa PLC. I think that's all. That's the last one.
So I mean, have you got an understanding or you still need?
Yes, it's just like a summary. I'm gonna check the account, the financial results center for Bupa Group.
Exactly.
So then, if I once I check it, it will be able to put light to these questions.
Mm-hmm. Amazing. If you have any issues, you can message me, okay?
Yes, sir.
All right.
So that I
So
think that's
that's
fine.
amazing. Amazing. I hope you're okay.
Yeah, I'm fine. Thank you so much for your
You're
time,
welcome.
sir.
You're welcome.
Thank
And
you.
then congratulations in advance in your practical.
I will tell you next Sunday.
All right. Take care, right?
Yeah. Bye, sir.
Bye.
Oh, let's call it a day, man.